Hello, dear members of the jury and dear participants. Let me introduce myself. I am Toshvero Desrailuna from Bukhara State Medical Institute, and I am assistant of the Department of Obstetrics and Gynecology. Now, today's my presentation theme is studying the reasons of obstetrics and gynecological and somatic complications on the background of preterm discharge of amniotic fluid. Premature prenatal rupture of the membranes, spontaneous rupture of the amniotic membranes before the onset of regular uterine contractions in the period of 22 and 37 weeks. As you see, that's premature prenatal rupture of the membranes. It can lead to serious problems, that's chorioamnionitis. Etiology is not critical and sometimes unknown. Syndrome approach to patient management. And one of the serious complications is for mothers. It's called, as I said, that's chorioamnionitis, and for the fetus, it's premature sepsis, hypoplasia of the lungs. Relevance of the problem. Complicating the outflow of amniotic fluid is one of the most important problems of modern obstetrics. The rupture of the membranes is the reason for the initiations of the labor in 80 to 92% of cases, depending on the duration of pregnancy. Untimely discharge of amniotic fluid is closely associated with the risk of purely septic complications of the mother, chorioamnionitis, as well as perinatal infections. The development of chorioamnionitis causes complications during pregnancy and childbirth, which leads to the development of a septic state of maternal infection. The discharge of amniotic fluid can lead to complications during pregnancy, childbirth, or the development of disease in the postpartum period. Purpose of the study: to study causal factors as well as obstetrics, gynecological, and somatic outcomes of labor in women with premature rupture of the membranes and tactics of labor management. As you see in this slide, we can see that some material and research methods. And the research material was the history of the birth of 106 pregnant women in whom the birth was complicated by preterm rupture of the membranes in the period from 22 to 36 weeks of gestation and delivery in the Bukhara Regional Perinatal Center for the period 20 and 17 and 20 and 19. The anamnestic data of the somatic obstetrics and gynecological status of all pupils were studied when collecting an anamnesis, the course of the present and previous pregnancy, childbirth, and the postpartum period was carefully studied. Also analyzed laboratory parameters, the degree of readiness of the birth canal on the Bishop scale according to the indications. And we divide in two groups. And one of that main first group is consists of 56 pregnant women and with only amniotic fluid flow. And second group, it's 50 pregnant women. It were 50 pregnant women and with amniotic fluid flow and signs of chorioamnionitis. And third was control group. Results and its discussions. The average age of women was 26.5 years. In all, women pregnancy proceeded against the background of an aggravated history with a combination of obstetrics, gynecological, and somatic diseases. So, in this slide, we can see that obstetrics history of women examined. So, we divide that's primary paris and multiparis women. And multiparis woman 63 and primary paris woman was 43. So multiparis prevailed in parity, which amounted to 59.4%, and almost 1 in 3 multiparis women had a history of artificial abortion, reproductive loss, such as non-developing pregnancy and spontaneous miscarriages were often found in both groups. Gynecology history of women examined. A gynecological history of examined showed that more than half, 76, it's about 71.7% of pregnant women had a complicated history. 27 women indicate cervical diseases, mainly cervicitis. In 26 chronic inflammatory diseases of the appendages and vagina. In 40 and sexually transmitted infections, for example, chlamydial, herpetic, uroplasma, were diagnosed in 80 women. Retention, formation of the ovaries, cysts, were diagnosed in 3 women. Diathermic coagulations of the cervix due to erosion was performed in 13.2% of cases. A history of various surgical interventions in the genitals was in 11 women, which amounted to 10.4% of cases. So in this slide, there is presented somatic status of women examined. So, assessment of somatic history. A pregnant woman with premature rupture of amniotic membrane had a burdened somatic history. In the structure of extragenital diseases was myopia, iron deficiency, anemia, and diseases of urine system such as pyelonephritis, urolithiasis, cystitis, as well as diseases of the laryngo-otorhinology organs, for example, tonsillitis, sinusitis, and diseases of the gastrointestinal tract. For example, it may be gastritis, pancreatitis, and diseases thyroid glands, thyrotoxicosis, and euthyroidism. And bronchopulmonary diseases, it's bronchitis, bronchial asthma, and other diseases. So during that preterm discharge of amniotic fluid, we should assess the cervix of the uterine. For this, we use Bishop scale. That's Bishop cervical maturity assessment. The assessment was carried out according to 5 criteria. It was revealed that 40.6% of the examined pregnant women had disclosure, length, consistency, position of the cervix, and the conditions of the pre-existing part of the fetus we scored off up to 5, which was assessed as immature. And in 61.3% of women, the birth canal was assessed as a mature. Accordingly, the tactics of further conduct was chosen according to the Bukhara prenatal center protocol. Pregnant woman with an immature neck, premature rupture of the membranes, combined with obstetric complications according to the protocol. Induction of labor by glandin E2, 3 mg per 1 tablet intravaginally after the informed consent of the pregnant woman and relatives was proposed. A discussion was held about possible complications of labor excitement. So, finally, I can say that a study of obstetrics history has shown that the presence of abortions, missed pregnancies, spontaneous miscarriages in more than half of the subject, as well as previous pregnancies that ended in complicated birth, are factors contributing to preterm rupture of amniotic fluid. Gynecological history was burned in 71.7% of the subject. Chronic inflammatory disease of the appendages and vagina in 37.7% diseases of the cervix uteri, in 25.5% uterine fibroids and 5.7% and ovarian cysts in 2.8%. 81.1% of pregnant women had a weakened somatic history. The most frequent pathologies of the examined patients were iron deficiency, anemia, and 36.8%, and also disease of the urine system in 10.4%, pyelonephritis, cystitis, and urolithiasis. Clinical and anamnestic risk factor for pregnant women complicated by preterm discharge of amniotic fluid are a history of endometriosis, pathological growth of conditionally pathogenic cervicovaginal microflora, chlamydia, non-specific colpitis, and bacterial vaginitis. The presence of infections adversely affect the course of pregnancy and childbirth. After the discharge of amniotic fluid, antibiotic therapy should be started immediately with the aim of preventing purely septic complications and expand management until the full term. If preterm rupture of amniotic fluid is complicated with chorioamnionitis, then childbirth should lead with active knowledge that induction of labor with carry on the uterus is the activation of the control ability of the uterus with the onset of labor, while successful inductions is a natural delivery within 24 and 48 hours. Thank you for your attention.